One, thank you for joining me at this outstanding school, Manor Haven, and I had the most enjoyable breakfast I've had in a long time, speaking mostly to third graders about what life is like now that we are instituting a program that I'm enormously proud of, which is ensuring that every single school child in the state of New York has free breakfast and free lunch. And why is that so important? Well, first of all, it's a savings for parents. Parents across the state are struggling with the cost of everything, the back-to-school sneakers and clothes and backpacks. And one more cost for parents is either to have to pay every day for their children's lunch or to have to make lunches, which I never enjoyed doing either. So it saves about $1,600 per year per child. So a family of two, I met this lovely little boy and little girl. They were twins, and that's $3,200 of savings right there between those two children in one family. So it's a savings for parents as we're fighting our issues on affordability, putting more money back in parents' pockets. The other one is there's a stigma associated with children who have the free or subsidized breakfast or lunches. And it's real. When I announced this here on Long Island, right after my State of the State address, we had a large gathering at a neighboring school, and I remember, Republican state legislator came up to me and said, you know what, this is transformational what you're doing. And I said, why is that? And he says, I was one of those kids who, because of the stigma, I never went to lunch. I skipped lunches every day because I didn't want to be embarrassed. The fact that I was singled out as a student whose parents couldn't afford to pay fully for lunch. And so that meant a lot to me as well, that we want to remove the stigma, put money back in parents' pockets, but also it is so important that our kids have every advantage possible to them when they're in our schools across the state. Why is that? I want to make sure that no child is hungry, that they're 100% focused on learning and the teacher's message to them and the curriculum and making friends with students. So it's all about making everyone's family my fight, and it's making sure that no child goes hungry in school, that their attention span is vast because they're not thinking about their stomachs hungry in the next meal. But also we've talked about this over the last year and a half about removing cell phones from schools. And I could not be more excited about the returns that are coming in already. The transition, of course, we knew it was going to be tough. It takes some time, but right now New York is the largest state in the nation that has a full bell-to-bell K through 12 strategy to make sure that our schools are distraction-free. I was in a school in Brooklyn yesterday and handed out what they use as yonder pouches, showing the students how to use them. And the kids who had been in a class environment before the previous year who had already surrendered cell phones, they're telling me that the schools are noisy, that kids are talking to each other, they're making friends in person, they're studying harder, they're learning more. So all the results are trending very positively, and I'm very, very, again, excited that this was an initiative that we undertook against a lot of opposition, but we came through, and I know that at the end of the day, our children are going to thrive without the stress of having that addictive cell phone bombarding them with messages all day long when they should be learning and making friends. So that's what we're working on here today. As I talk about fighting for families, your family's health is everything to me. I was the mom who always made sure that my children got their vaccinations on time. Even as an adult, making sure that everyone I knew in my families could ensure that they knew how important it was to get the COVID shots over the last 5 years and how life-saving they are. When you think about the fact that the state of New York lost nearly 86,000 of our residents to this horrible, horrible illness, and what stopped those numbers from growing exponentially was the fact that we had very much accessible COVID shots, vaccinations, and to hear that the Trump administration is basically ignoring science, ignoring health, and making decisions that are just starting now that will have nothing but a negative effect on our family's health. And so here in New York, I can't sit on the side and let that happen. When they said that they're not going to be requiring COVID shots and other vaccinations for our families, I said, no, here in New York, we'll make those parents have the option. if you want your child to have a COVID shot, it should be available to you, and it should be covered by insurance. And that's something that's really important to me. So what I'm doing now is signing a executive order, because extreme times call for extreme measures, and this is a power I have to use this in the interim until we were able to have the legislature get back together in January and pass legislation that mandates this. So what I have here is an executive order to allow pharmacists to be able to administer COVID shots for the next 30 days. We can renew this every 30 days, but when you change state law, you're required to review it every 30 days. And we're going to continue developing a long-term plan to fight these reckless decisions coming out of Washington, because I have no choice. It's not a mandate for families, but I know a lot of families that want to make sure that their kids are healthy when they're exposed to other students in school. And I want to let people know the number of cases, COVID, are on the rise in New York. We have about 600 new cases per day. I have many friends and family I know who are suffering from it right now, but this is the time of year when you'd normally be getting your COVID shot. I plan on getting mine very shortly. But to have the federal government say that only people over the age of 65, and they don't even recommend it for expectant mothers anymore, and not cover children and family members, I don't understand that. I don't understand why you won't let families have the choice to protect their children's health. That's what this is about. And so I'm prepared to sign this now. Let everyone know how seriously we are taking this, an executive order declaring a disaster in the state of New York due to federal actions related to vaccine access. And this explains the laws that we need to modify for now. And I'm looking forward to signing this as we stand here, because I want to get this on the books and make sure that the status quo as it existed before the federal government decided to ignore the health needs of our families before they took these steps, that the status quo remains in the state of New York. So you can go into a pharmacy, not have to worry about going to a doctor's office and getting a prescription, which is another step that I think a lot of people just don't have time in their busy lives to handle. They can go into a pharmacy as they're accustomed to doing, and the pharmacist will now, as a result of this signing, be authorized to administer COVID shots to those who choose to have them. The order is signed and now in effect. And with that, I will make this official, get this to the right people. Happy to take any on topics right now.
We're going to start with on topics first. We got Zach Nash from Schreiber News Network.
Hi, Governor Hochul. My name is Zach Nash, and I'm a senior at Schreiber High School here in Port Washington. I'm here on behalf of Schreiber News Network, which is a media team at our school. And I know that there are issues in New York State and across the country with an increase in childhood obesity and linked processed foods. How do you think that this program could help with those issues?
What we're doing is making sure that children have access to food, number one. One of the drivers of childhood obesity, which I am deeply concerned about, because this has lifelong impacts on their overall health. We need our kids to start out healthy. They have physical education, they have exercise. We want them to build in just a routine of understanding how important it is, but it's also the nutrition. So when children do not have access to breakfast or lunch for free, as we're now starting to provide across the state, they're more apt to snack on unhealthy foods. And you never hear a snack of being healthy in most situations. Kids are used to grabbing something that just fills their stomach to keep them going again. I want our children to have their stomachs full from breakfast to lunch and beyond, and I think that'll go a long way. This policy will go a long way toward abating that really is a crisis of childhood obesity. But thank you for your attention to the issue.
Thanks, guys. On topic, CBS.
Are you considering the executive order on topic? Or?
Yep.
If you have a school question, we'll
You
start
want to
topic,
do
and
okay.
anything else we'll
School
just
first.
use our friends.
Sorry. Any other school-related questions? Dennis?
Yeah. How you doing? Good morning.
Good. Hi, Dennis.
Do you feel like the elementary kids were asking harder questions in the media?
Yeah, they were tough. Yeah, they're asking you to choose basically your favorite child. My favorite sports teams. So no, they were adorable. So it was. I think I was prepared for them because of my years of having to go before the New York State Press Corps. But they were tough. They were tough.
They're actually pretty smart. They know a lot of
They're very smart. They were smart kids. I could have sat there all day and had serious conversations. And when they came and gathered around me afterward, they looked at me like they didn't want me to leave anytime soon. I love little kids. I just gravitate to them. Walking down the street, I'm more apt to say hi to your little baby than anybody else on the streets as I'm taking my strolls every day. But I know it was fun.
Any other school-related questions? That's it. All right, well, thanks, gentlemen. From,
Thanks for coming,
and
guys.
school officials.
Yeah, I
You're
appreciate you.
Here you go.
It's an important part of our institution to have a free and healthy stress score, right, everybody? Yes. See you next leaders.
Good luck to you guys.
Thank you.
Oh, yes.
Thank you very much.
Thanks, guys.
Oh, you can go. You want to go this way?
Probably nothing else on your minds today, right, guys? It's always good to be out here.
All right. CBS.
How are you? John Diaz from CBS. When it comes to the new executive order you signed, is there hesitancy because of the federal guidelines, and is it in response also to Florida's policy change?
Right. Now, this specifically pertains to COVID shots at this moment, but my team is working around the clock to ensure that whatever Washington does, that we're prepared to respond, so there's no gap in coverage for New Yorkers. Now, what Florida is doing, I find unconscionable, that you're denying the options for families who want to keep their kids safe. And sadly, I expect there's going to be a rise in childhood illnesses without the vaccinations in states where they're more callous about their children's health. I don't know how you ignore decades and decades of research that shows you can prevent these illnesses, which used to be debilitating, life-threatening for generations ago, that you ignore the fact that we've saved millions of lives with these vaccinations for children entering schools, and they just say, who cares? We're not going to do that anymore. I find that appalling.
And I just have one follow-up question. Are the vaccines covered by the state version of Medicaid?
We're going to make sure that everyone who has health insurance has coverage of this. We're actually working with there's a question about whether or not your insurance policy covers this, separate from Medicaid even. Yes, Medicaid covers it. But for those who have traditional insurance, many of the large insurers have said they'll cover it anyhow, because if you can prevent an illness, isn't that a lot less expensive to treat in the long run? No illness versus someone who has a life-threatening disease because they didn't get a vaccination. So the insurance companies understand how important these are, but we're going to work through some of the details. Again, a lot of this can be settled when we come back with more comprehensive legislation in January. It just said, I can't wait that long. We are in peak COVID season. It's starting up now. The cases are going up. People need to be aware of this. And this is the time when people should be thinking about getting their shots for themselves and their families if they choose.
Okay. ABC.
CVS and others said they would require a doctor's prescription. Personally, how do you feel about that? And then why did you feel the need for this executive order?
Because I don't think people are going to take the time to go get a doctor's prescription. I think that people's lives have become conditioned to be able to walk into a pharmacy, and I want to keep the status quo. I want more people to get the vaccination if they want it. I don't want to have barriers to they or their family's health because of this artificial roadblock. And even the prescription idea, well, does the person already have to be showing symptoms? Do they ought to be sick? Because basically Washington is saying only people over 65. So what proof do they have to show to a doctor, or does the doctor have to establish that this person is sick enough to have it? They just changed all the standards. This is a preventative measure. Everybody who wants it should have it readily available to them, and that's why we're doing this.
Okay, two more. Sure, go ahead. Yeah. News 12.
Hi, how you doing? Tom Shaw, News 12. Now, this is just for New York State residents, correct? Like someone that's undocumented or someone that lives in a different state that want to get this, can they? Or like, how does that all work?
Let me get you the answers on this. We moved very quickly to get this out as soon as possible. I don't know about someone out of state. That's a good question.
Do they need ID
yeah.
to get their shot or vaccination?
Our position now, and I'm going to clarify this, but our position now is to keep the status quo the way it is. Exactly. That's the purpose of this executive order. keep the status quo, so the people who are able to walk in right now and get a COVID shot would be able to continue to do so without barriers in place.
Okay, last question. Maura, you say.
Thank you. What can you tell us about immigration and customs enforcement activity near schools on Long Island and elsewhere in the state?
Well, it's very disturbing to me what is happening in our schools, and these are supposed to be sanctuaries and a safe place for our children to learn. And our schools right now are getting guidance from our state education department, the Know Your Rights, also plans for families. I mean, sadly, these children need to know what happens if they head home from school and the parents are no longer there, or that something happens in a school environment to a student. They're not allowed to come onto the school grounds unless they have a warrant, a criminal warrant. But when the children step off the grounds, there is a vulnerability there. But I would just say this. I won't support any effort to separate families. I think it's appalling. I have said all along, I will help the federal government remove people who are threats, that are violent criminals. This is what the president promised during his election. This is what we are told. Go after the worst of the worst. It's all we heard about. And now you have raids, mom and her daughter separated here on Long Island. We had the raids on the farms up in upstate New York, 40 people. You know what happened when they took those 40 families? The kids came home from school and there's no adult in the house. So I find it unconscionable, but I'm going to make sure that everyone knows their rights and that the state education department continues communicating with parents on what they need to know should this happen in their school to their children. All right, we good?
Governor, your thought on the president possibly offering a job to Mayor Adams and Curtis Fleetwood to get them out of the New York City mayoral race?
Well, contrary to what the president thinks, he's not a king. He's not a kingmaker. And he should be not anointing the next mayor of New York City. That is the right of New Yorkers to determine. And no one should be accepting that assistance. It should be rejected. Otherwise, there'll be a sense that people are compromised if they're getting the road cleared because of who the president wants as the next mayor that he believes he would be able to control. Clearly, that's why he's doing it. I have to stand up against that. I want to make sure that our elections continue free and clear without that kind of interference, and I reject those efforts wholeheartedly.
All right, thanks everybody. Thank you. Appreciate the time.
Thanks, everyone. Appreciate you coming out. Take care.
Thank you, Governor.
Governor Kathy Hochul recently held a press briefing in which she discussed several key initiatives aimed at improving the lives of families and students in New York. One of the most significant announcements was the implementation of a statewide program that guarantees free breakfast and lunch for all schoolchildren in New York. This initiative is designed to help families save money, especially as many are facing rising costs for back-to-school supplies like sneakers, clothes, and backpacks. By providing free meals, parents will save an average of $1,600 per child each year. The governor shared an anecdote about meeting a set of twins whose family would save $3,200 annually thanks to this new policy. She emphasized that this program not only helps alleviate financial pressure, but also removes the stigma associated with receiving subsidized meals. A Republican state legislator shared his personal experience of skipping lunch as a child because of the embarrassment he felt when singled out for receiving free meals. Hochul explained that the goal of this program is to ensure that no child goes hungry in school, allowing them to focus on learning without being distracted by hunger. By ensuring that every child has access to nutritious meals, the state is helping children engage more fully with their studies and their peers. The governor also highlighted the success of another initiative, which has led to the implementation of a ban on cell phones in New York schools. This initiative, which is now the largest statewide policy in the nation, has been shown to reduce distractions and encourage students to engage more with each other and their schoolwork. Many students reported that without the constant pull of their phones, they were more focused, more social, and more dedicated to their studies. This policy is being praised for its positive results, despite initial resistance. Another major topic Hochul addressed was the rise in childhood obesity and its link to unhealthy eating habits, particularly the consumption of processed foods. She linked the free meal program to a strategy for combating obesity by ensuring that children have access to nutritious food during the school day. By eliminating the need for children to snack on unhealthy options, the program aims to instill better eating habits and improve long-term health outcomes for students. The governor also took the opportunity to discuss her executive order regarding COVID-19 vaccinations. Hochul expressed her concern over the federal government's decision to limit access to vaccines for certain groups, particularly children. With cases of COVID-19 on the rise in New York, the governor signed an executive order that allows pharmacists to administer COVID shots without the need for a prescription. She criticized the federal government's stance, which she said would result in fewer families having access to life-saving vaccinations. Hochul emphasized that this policy was about choice and ensuring that families could protect their children's health without facing unnecessary barriers. In signing the executive order, Hochul made it clear that New York is committed to safeguarding public health, particularly as the state enters the peak season for COVID cases. While this policy does not mandate vaccinations, it ensures that families who wish to vaccinate their children have the ability to do so easily and without unnecessary hurdles. The governor's actions come in response to federal policies that she believes ignore science and health recommendations, especially in light of the challenges posed by the ongoing pandemic. During the press briefing, the governor also responded to questions regarding immigration and the recent actions of Immigration and Customs Enforcement, ICE, near schools. She expressed concern over the vulnerability of children in mixed-status families, particularly when ICE conducts raids that separate families. Hochul reaffirmed that she would not support any efforts to separate families and reiterated that the state would continue to provide guidance to families on their rights. She criticized the federal government's actions, stating that it was unacceptable for children to return from school to find that their parents had been taken away by ICE, leaving them without care. In her closing remarks, the governor discussed the importance of ensuring that every family in New York is able to thrive. She emphasized that her administration would continue to fight for families' health, education, and overall well-being, no matter the challenges posed by federal policies or external factors. Through the initiatives she outlined in the briefing, Hochul aims to make life easier and more equitable for New York's children and their families, ensuring they have the resources they need to succeed.